Many people think the healthcare crisis starts here at the doctor's office. However, it starts way before that. Worldwide, 32 out of 33 countries have some sort of universal health insurance. The country without, the United States. Of those 32 countries, they pretty much use three different types of funding. There is the single-payer system, in which the government pays for an individual's medical care solely, usually through taxation. There is the two-tier system, where the government provides basic coverage, but not for specialty cares or extra cares. However, they may be reimbursed for a portion of that. And the insurance mandate, which mandates citizens to purchase insurance and obey law related to medical issues. However, I think there is a much better plan that we could utilize in America. First, it starts with the medical issue. Now, with universal health care, everybody would be able to go to a public universal insurance hospital. Through taxation, it provides basic medical cares, equipment, preventative cares, and people are not assigned to one doctor. It's kind of where you go in, but it is free, and there could be longer lines within that. Specialty hospitals would be for anything beyond basic care. They would be attached to a reimbursement rate in which the government would reimburse the insurance companies or the medical facility for the cares, but the patient would still be responsible for a certain portion. With childbirth, the patient would be responsible for 2% of the cost. Thirdly, there is a private insurance option where people can pay, in addition to their taxes, for a higher level of medical care. In these public hospitals, private hospitals rather, they will have the highest cares, they would have the best innovation, the best research, brand name medications, and just the best of everything. And people are paying for that, so it's good that that service is available. What this plan does is it doesn't force people into just one plan. They do have options, and it's options for every socioeconomic level. And people are not forced to do things against their will besides the amount of taxation. In France, a system where they're running a very similar type of healthcare, the French are charged 2.5% of their annual income to receive healthcare. Furthermore, children under 18, seniors over 65, and individuals with developmental disabilities are covered for public and certain specialty cares. Now, don't get me wrong, the public hospitals are still going to be licensed and accredited, and the private hospitals are going to have a greater continuity of care. So there are positive and negatives for both options. With this discussion must come funding. Taxation of personal income tax as well as corporate tax would be the beginning. Additionally, there would be an increased sales tax on alcohol, cigarettes, and some fast food, as they can be detrimental to a person's health. Therefore, if an individual chooses to use such a substance or consume a product that is detrimental to their health, they should be paying a little bit into the fund for future health problems. Increased taxes on lottery proceedings is something that we can do. And with the taxation on working class, there would need to be some sort of welfare reform to ensure there are enough working class citizens. That includes drug testing for recipients, having a time and benefit limit, and analyzing what constitutes a disability so that we can try to get as many people working as possible. Now, this whole thing does not come without several ethical issues. I do believe that it is ethical as Americans that everyone should have a chance to be happy and healthy throughout life. My views are kind of utilitarian, where it's the greatest good for the most amount of people, and things that reduce health get an extra tax. Unresolved ethical issues would be funding for spiritual care in the healthcare system, meaning if we have a free system through taxpayer money, it is against the First Amendment to use that money for religious-based reasons if it's gained through taxes. That would be the separation of church and state. Furthermore, if all different cultures and classes of people are paying into the same system, you would need to make sure that there is spirituality care for all different types of religion, which can be pretty difficult for more urban and low-budget facilities. End-of-life cares would be another issue. A lot of times when people are at the end of their life, their cares can cost up to $50,000 a week, if not more. With public health insurance, it would be very difficult to continue that cost for an exaggerated amount of time. There would have to be some determinant on the levels of when when that happens and when care can be discontinued. Lastly, allowing people to fail versus personal rights. I think it is ethical for us as Americans to not allow our fellow Americans to fail. It might infringe on certain people's rights through taxation and through mandates if that's the route that we choose to go. However, if so many people that are in need don't get help, I feel like everyone loses. Thank you very much and have a good day.